Hello, I'm Dr. BALA'S. Today we shall talk something about diabetes and numbers. Most of the things we measure in numbers only. And based on the numbers, we say this is normal, this is abnormal, and this is expected, this is unexpected, and all. When the number increases, you will say that you are at risk of getting this thing. Even age is a number, but as the age increases, the possibility of getting problems increases. Diabetes is also based on numbers only. You say normal people, non-diabetic people, and you say pre-diabetic people, the possibility of getting diabetes is more, and then you say you are a diabetic. All these are based on numbers. If these numbers are maintained within normal range, they are not absolute numbers, they are only range. If you keep yourself in this range, the possibility of getting diabetes is less. And if you are diabetic, if you keep your numbers within this range, the possibility of getting complication is less. For diagnosis, for prognosis, for prevention of complications, everything is based on numbers only. When you take a blood test, you get your value, and by the side you get the normal value. You compare this and you come to a conclusion whether you are normal or not. So what I want to tell is, when these numbers which are readable, which are understandable by you, you need not go to a doctor. Only when the numbers exceed a particular limit, you go to a doctor. The doctor decides what to do, whether it's just a lifestyle modification or you need medicine. So by applying this, you are bringing back the number to normal number. Now when you take a test, if the report comes within normal limits, and if you are diabetic, you need not go for other specialized investigations. So we restrict ourselves to only blood tests. We are not going for other tests because you know that you have some problem and you go to a doctor and the number becomes normal, and again, or conclude things or infer things from the results. For knowing the numbers, you don't need a doctor. So these are all within your reach if you don't complicate things. Complications arise only when you complicate things. Diabetic doesn't produce complications. You complicate diabetes, that is why you end up with complications. This is how the result goes. At this level, you don't need any expert. Now, even after seeing the numbers raised, or you consult too many people and everybody says one advice, so if you don't take action to bring the numbers to normal, then the final result is complications. Now what you do, you go to the next level of investigations. From numbers, you go to the next level which you cannot understand. You need a doctor. Now you go for X-ray, you go for ECG, you go for echocardiogram, and you go for treadmill test, and finally you may go for angiogram. And then you go to a doctor to check your eye, vision, cataract, retina. Then you go for ultrasound scan to test your abdominal organs. For example, the liver, the deposition of fat, a fatty liver. And you feel that I have some burning sensation in the foot, loss of sensation in the foot. Now you go for Doppler to know the blood supply to the lower extremities, your legs. Now, this X-ray, ECG, echo, treadmill, angio, and ultrasound, all these tests, you cannot read those tests. You face technical words. The doctor has to go through the results. The doctor will explain what you have, and many things you don't understand. And finally, you say, do something, doctor. When it was just numbers, you could have done a lot of things to bring the number to normal. Now, you don't know what to do. The doctor should advise what to do. To that level, you are gone. That is why I say, keep the diabetic at the number level itself. If you maintain this, the following numbers, what I'm going to say, you will not go to the next level of investigating yourself with sophisticated investigations. Don't you think these numbers are very important? And diabetic is just a number game. Shall we see what are the numbers? Remember these numbers, what are I say? The first thing is, it's not directly related to diabetes, but the possibility of getting diabetes is more if this number is more. Number one is your BMI, body mass index, based on your weight and height. It is a calculated value, and the value should be less than 25. Overweight, obesity, all these are linked with a bad outcome diabetes. So 25 is the first number. The second number is your waist circumference, the pot belly. The more it is, the more the possibility of getting a metabolic syndrome, in which diabetes is one of the components. Your waist, for a male, it should be less than 40 inches, and for a female, it should be less than 35 inches. The third number is your blood pressure. What should be your blood pressure? It should be around 120 millimeter by 80 millimeter of mercury. Never get upset when the baby is high, because it's a range. Plus or minus 10 is okay, possible. It depends upon your mood, your activities, etc. So this should be measured on various occasions, many times, before conclude that you are a hypertensive or increased blood pressure. It should be around 120 by 80 millimeter. If you are a hypertensive patient or a blood pressure patient who is taking medicines, then it should be around this number. Diabetes mellitus itself can cause an increase in blood pressure due to increase in cholesterol and atherosclerosis, the hardening of the blood vessels and deposition of the cholesterol. All these can increase the blood pressure. That is one thing. The other thing is, a person who is having an increased blood pressure is susceptible for diabetes mellitus. So this is another number. So we have seen the BMI, the waist circumference, the blood pressure. These are all not directly linked with diabetes mellitus, in the sense we call it as risk factors. When I say risk factors, the possibility of getting diabetes mellitus is a bit more if these people have this increased number. Now the next set of numbers are directly linked with diabetes mellitus. Why I say directly linked? Based on these numbers, you will diagnose a diabetic, you will diagnose he's not a diabetic, and you can see the progress or prognosis of the diabetic person if he is on treatment. And even then, uneven, you can decide what type of treatment is suitable for this particular diabetic person. So remember one point, diabetes mellitus is a single disease, but every individual, the reason, the response, everything differs from person to person. That is why we always give individual care. The first test is when you really want to clear your doubt whether the person is diabetic or not. One. Second, whether this person needs only lifestyle modification, or he needs tablets, or he needs insulin. So this test is a very, very important test. Many times, many people miss this test. This test is called C-peptide test. C-peptide means connecting peptide. This indirectly measures the capacity of the pancreas in secreting insulin. There may be no insulin, less insulin, or more insulin. You cannot directly measure insulin level with ease. So what we do is we indirectly measure this. This test we take on two occasions. One is fasting level. Second is you stimulate the pancreas by giving food. So two level. The first level is the basal insulin after 8 to 10 hours of fasting, and the values should be around zero point 0.4 to 2.1 nanogram per ml. This shows during fasting your insulin level. Next is you give food and increase the blood sugar level and see the response of the pancreas. This will show how much insulin to the maximum pancreas can secrete to bring back. This is 2-hour postprandial C-peptide test, and this value should be around 2 to 4.5 nanogram per ml. The next test is a fasting blood sugar level. 8 to 10 hours of fasting, you have your dinner, and after a good sleep, get up in the morning and you take a fasting blood sugar. This value should be, it's a range 70 to 100. When I say 8 to 10 hours fasting, you may take your breakfast even 11 o'clock, 12 o'clock, something like that. But this test should be done exactly 8 to 10 maximum hours after your last your dinner. What is a diabetic level? The diabetic level is 126 milligram per 100 ml on 2 occasions. And if it is more than 125, even 126 on 2 occasions, you are branded as a diabetic person. In between, you call them as a pre-diabetic people. That is, the possibility of getting diabetes is more. Next test is 2-hour postprandial sugar. Prandial means meal. The first point is 2-hour. You take 8 o'clock breakfast and 10 o'clock you take, not 2.5 or not 1.5, like that. This value should be less than 140 milligram, at the most 140 milligram. Okay, then what is a diabetic value? The diabetic value is 200 milligram per 100 ml. In between, if you get a value in between, then you may, that is pre-diabetic value. As the fasting sugar pre-diabetic, this is also a pre-diabetic value. Okay, now the next thing is, I have taken fasting blood sugar, postprandial blood sugar, but this tests are taken on a particular day. This shows your value on that particular day. I would like to know, you can at least have an average sugar in the past 90 days or 3 months. You call it HbA1c. It is a percentage. In a normal person it is 5.7, and for a diabetic person 6.5 to 7. If you have a 7% HbA1c, then that is a diabetic value. In between, of course, the pre-diabetic. So your C-peptide, your fasting sugar, your postprandial sugar, 2-hour postprandial sugar, and your HbA1c, these 4 tests will decide or you are a diabetic or not. So these numbers should be in check. I have given you the normal numbers. What is the next number? Lipid profile. Fat, cholesterol, lipid. They may look same, but lipid includes a part of fat and cholesterols, various types of cholesterols. This is profile. That means you have total number and you can divide into fractions. That is why it is called a lipid profile. In this you have what is called total cholesterol. That is around 200 milligram per 100 ml. It should be less than 200 milligram per 100 ml. Next comes triglyceride. Triglyceride is a type of fat actually. I told you fat is a nutrient, a macronutrient. It is a type of food actually. Cholesterol is not a type of food. So this triglyceride level TGL, it should be less than 150 milligram per 100 ml. Next is LDL, low density lipoprotein. This measures a type of cholesterol. You call it bad cholesterol. We are not directly measuring the cholesterol, but we are measuring a type of protein which carries this cholesterol in the bloodstream, and they are called a lipoprotein, LDL, low density lipoprotein. This should be less than 100 milligram. The next is VLDL, very low density lipoprotein. It should be less than 30 milligram. VLDL is not directly measured, but it is calculated. VLDL, if it is increased, naturally the triglyceride will also be increased, because VLDL mostly carries triglyceride. So whenever there is more triglyceride, definitely the vehicle should also be more. So this LDL and VLDL, you call it bad cholesterol. When there is something bad, there should be something good. What is that? HDL, high density lipoprotein. HDL, why it is good? We'll see some other time why it is called good cholesterol. And the level should be around 40 to 60 milligram per 100 ml, at least 40. See, now you have bad cholesterol and good cholesterol. Now the question is, can I increase my good cholesterol, or can I decrease my bad cholesterol? Can I increase my strength, or can I weaken my enemy's strength? It is easy to reduce bad cholesterol than to increase HDL. There is no medicine to increase HDL, but there are medicine to decrease the LDL and VLDL, etc. So these are the numbers you have in lipid profile. So keep these numbers in this level. Next thing is your kidney function or renal function. An impairment in the kidney function or renal function is not going to produce diabetes mellitus. It's not a risk factor, but a diabetes mellitus can damage your kidney. So these tests we usually check for diabetics to know their kidney condition. It starts with the first simple test, what is called 24-hour microalbuminuria. Albumin is a protein we need. That means the kidney should not allow the protein to get out of the body. If there is a problem, you will get more albumin in the urine. Why it is called microalbumin? It is not the size of the albumin, but in very low quantity it is there, less than 30 milligram. That is why microalbuminuria. We take 24 hours urine and measure how much of albumin is present in this 24 hours urine by testing a sample. And this is a very gold standard test, which will give you a clue that this person may go for. Next is urea and creatinine. Both are waste products. One is a waste product when protein is metabolized. The other one is, it is from the muscles, creatinine. See, the kidney's function is, so it is not supposed to keep the waste inside, and it is not supposed to send nutrients outside. That is why it is called a selective filtration. So urea should be around 40 milligram, and the creatinine should be around 1 to 1.2 milligram. Based on these values, another value is calculated or estimated. This is called EGFR, estimated glomerular filtration rate. This is not directly measured, but how much of blood is filtered by the kidney every minute. This will decide the capacity of the kidney. In a normal and healthy adult, it should be more than 100. As age advances, this filtration capacity is reduced. It may go up to even 60. But if there is a problem in the kidney, this filtration capacity is lost, the function is lost. So it may not filter even 30-40 ml of blood per minute. And as I told you, this is an estimated value. So these values you should remember: 24 hours microalbuminuria, blood urea, serum creatinine, estimated GFR. This is for your renal function test. Well, these are the values you should keep in check. And I think I'm justified in telling you that diabetes is just numbers. If all these numbers are kept in check, if everything is normal, you are not a diabetic. If every number is normal, but you are a diabetic under treatment, that means you will not get complications. You will not need other sophisticated investigations, as I said, ECG, X-ray, scan, angiogram, Doppler, all those things you may not need, because you are 100% under control. So I think you will now know the importance of these numbers. Just to make a note of all those things. I think this video is a bit useful for people who are diabetic and people who want to know diabetic endo. Can we meet in some other video on some other topic some other day? Thank you.